So for one, I wouldn't bother to do that until someone had abnormal hip flexion range of motion, because it's a lot of work and it can be, sometimes you can find it when you want to find it, right? You know, like it's such a small maneuver that, or such a small motion that you might get false positives. So the first clue would be, all right, they have a lack of hip flexion range of motion. I need to figure out, is that joint capsule or is that just glute max tightness? So probably one of the simpler ways to figure it out is based on the end feel. If they are really impinging, really irritable, you might get an empty end feel, right? And so what they're feeling is the femur is hitting the inguinal ligament typically. So the inguinal ligament's right here. If you're gliding properly, you should be able to get your full range of motion before you hit that inguinal ligament, right? And for most people, that's going to be being able to hit their stomach about. So if he feels it before that, that means that the femur has traveled forward slightly and then it hits it earlier, right? So it might be an empty end feel, or you might actually feel them kind of tense because their body just naturally doesn't like that feeling even if they're not consciously doing it. Okay, there's other things that can cause impingement as well, but we're talking about somebody that's like in their 20s, so it's not likely to be like a bony overgrowth or something like that. Okay, and then the other thing that I could do is I could, once I've been really good at doing my joint mobs, I can compare how his posterior glide feels to other folks that have it, and finally I can ask him, where does he feel the restriction when it stops? Okay, a normal place to feel a restriction would be their glutes. Oh, my butt just feels like it's being stretched, right? An abnormal response would be, oh, it feels like I'm getting pinched right here near my underwear line, right? And so then, if I wanted to understand if it was anterior hip glide syndrome, which is this called in the Shirley Sahrmann sort of language, I would feel for, as I hit the restriction, if the greater trochanter ever so slightly goes forward. So it's a really, really advanced technique, but it's worthwhile to practice just because it helps you to get better at your palpation. Your hands are not just like, I don't know how to put it, they're not just like rods or whatever. These are your most, you have the most sensory receptors here in your hands. If you practice with your hands a lot, then you don't have to think about what you're doing with your hands because you can focus on what you're feeling, right? So when you're practicing your palpation skills, try to diverge all your RAM, you know, in computer talk, to your one finger that's palpating, because you don't need any brains to do this, right? You can just have someone else do it if you want, you know, but try to focus everything you feel here. Close your eyes if you have to, because the world doesn't exist anyway. It's all just, you know, a mirage.
The Matrix.
Okay, so as far as joint mobs go, I'll give you two options. If my person is relatively smaller than me and I can use a relatively low table, I'll do the first option. So we'll show on Steven. So Bun, come on up. Oh, okay. So if I wanted to do a very beginning joint mob just to see if there's any sort of irritation here, I could just shift my weight through the femur and then just push backwards relative to his body. This isn't going to help anything as far as treatment. This is just kind of generally feeling what does the labrum feel like. So as soon as it's okay, then I'm going to go at least to 90 degrees. So for a shorter person than me, or when I have a much lower table, I can just kind of shift my armpit onto their femur and just drop it straight down and slightly laterally. Okay? And he's going to feel a little bit of a pressure back here. You feel that? Okay? Once I get past 90, just like the shoulder, I need to give some inferior flavor, as we've come to call it this semester. Okay? So there's a couple ways to do it. Probably the simplest way in this method would be to shift here. So there you go. You feel that?
Yes, I'll proceed.
Okay, so I'm leaning towards through his femur, and I'm holding his hip to stabilize it. That way I'm not just moving his SI joint around. So I'm just leaning on my armpit here.
Sorry.
Okay? And then as I get him towards end range, as I improve, then I shift a little bit more.
Sorry, guys.
Okay, so there. So now you can even see, look at his pants right here. Okay, so that's, because I'm moving the femur, everything else is moving. So that's what you're seeing there. And these types of joint mobs, in my experience, it's better to do a stretch mobilization as opposed to oscillation, because usually that they've been sitting on their butt for like, 15 years in school, and so the capsule has gotten real thick. Okay, so now let's bring your knees to your chest. He didn't have any restriction anyway, but.
Wow.
Does it feel different?
I don't know.
Okay, so that's where your height advantaged option is. So thank you, Stephen. All right, so let's have Kim come back.
Okay. And the right side.
Now Steven is.
So Kim, I don't know if he's taller than me or if I'm taller than him, but we're pretty close to the same size. He's a lot of femur, and this bed is pretty high for me. So it's effectively like a taller person than me. So I got to switch my style here. Okay. So here I can still do just a preliminary check. All right, everything's good. But when I get here, well, I guess I'm just tall enough I could do it, but let's assume I'm not. So why don't I do this? I'll hug his femur to my chest, lean in, and then just drop. Okay, you feel that?
Yeah.
So I'm almost doing a pull up on him.
Do you feel it on the glute?
Like here.
Yeah.
So you're pushing towards the door.
So you're
No,
going
I'm
that-
dropping down.
Just
Dropping.
straight.
But
Just
are
dropping
you
down?
going a little
Yeah.
lateral? Okay.
Yeah, it's like I'm climbing on my dad's shoulders, which he told me never to do.
Are you
Straight and
And then you're just using your body weight.
Straight and down.
Yeah, straight and just doing this.
The flavor in
Flavor lateral.
lateral.
Yep.
No inferior.
Quiet, and Kelsey louder, please.
For the first one, when you said a little inferior flavor, like how would you move that?
How would I do that one?
Yeah.
Okay, so a lot of ways, but I can do it this way. Rest the leg here. Good. And then do my snake grip.
What are you doing there?
So you're
Right there.
putting it out laterally.
Okay. And if his kneecaps are sensitive, then I can just grab here. Is that better? That better?
Yeah.
Felt that, Kay?
He has irritated kneecaps. Didn't you hear it cracking during the thing?
Yeah.
Yep.
I know.
Oh, I thought it was from shoes.
Yeah, no, that was his kneecaps. So you could either put like a towel or something to distribute your force here, or you can just, this takes a little bit more strength. Okay.
And the other one, because the other one makes your body shape.
Yeah. You can do it a lot of ways. So those are two methods. If you're still having trouble, then I'll try to work out a method for you. Okay. So the only difference really was where I was relative to the femur. Once we get past 90, we got to add a little bit of inferior flavor. The further we get, the more inferior flavor we have to give. Because now the bone is not going forward necessarily, it's going up. So our glide is becoming more down. All right, so let's see, did it make a difference for you?
Yep.
All right, so we'll just spend 5 minutes on it. I heard you guys don't